Pre-existing cerebrovascular disease is associated with poor outcomes in COVID-19 patients. Due to pro-inflammatory and hypercoagulation states, COVID-19 infection is believed to increase the risk of stroke and worsen the outcomes of the patients having pre-existing cerebrovascular diseases. The objective of this meta-analysis is to evaluate the outcomes of COVID-19 patients with pre-existing stroke. Studies with patients having cerebrovascular disease or stroke as one of the pre-existing comorbidities and described outcomes including intensive care unit (ICU) admission, mechanical ventilation utilization, and mortality were selected. We performed a systematic review to evaluate the relationship between pre-existing cerebrovascular disease and outcomes of COVID-19 patients and the pooled prevalence of the cerebrovascular disease. Meta-regression was performed to estimate correlation coefficient and odds ratio, and meta-analysis with the random effects model was used to calculate odds ratio along with its 95% confidence interval from the studies containing data on the composite poor outcome. The pooled prevalence of pre-existing cerebrovascular disease was 4.4% amongst COVID-19 hospitalizations and 7.5% amongst COVID-19 hospitalization with poor outcomes. In age-adjusted meta-regression analysis, pre-existing cerebrovascular disease was associated with ICU admission, higher need of mechanical ventilation, and higher mortality amongst COVID-19 hospitalizations. In meta-analysis, COVID-19 patients with pre-existing CVD had 2.67-fold higher odds of poor outcomes. COVID-19 patients with the pre-existing cerebrovascular disease have poor outcomes, and extra precautions should be taken in managing such patients during the ongoing pandemic. For more details, below is the link for this interesting study. Please review it and follow us for more videos related to research interpretation.